Hello, and welcome to the Penguin training session for patient follow-up. This training session will focus on how to follow up the patient after they've received their surgery. And we'll primarily be looking at discharge from hospital and the 30-day follow-up procedure. After surgery has been completed, patients will be followed up at time of discharge from hospital and then after 30 days after their operation. Patients must be followed up at 30 days because this data collection point is critical for assessing the primary outcomes of the trial. Primary outcomes. Pneumonia is one of the primary outcome measures and must be diagnosed within 30 days of the index operation. To diagnose pneumonia, the trial uses a modified central disease control definition. The patient must have at least one of the following: fever greater than 38 degrees Celsius with no other recognised cause, leukopenia or leukocytosis, and for adults older than 70 years of age, an altered mental status with no other recognised cause. In addition to above, the patient must have at least one of the following: new onset of purulent sputum or change in character of sputum, or increased respiratory secretions or increased suctioning requirements, new onset or worsening cough, or dyspnea, or tachypnea, rales, crackles, or bronchial breath sounds, worsening gas exchange, hypoxemia, increased oxygen requirements. Wherever possible, the diagnosis will be confirmed with a chest radiograph. Following findings would confirm pneumonia. New or progressive and persistent infiltrates, consolidation, cavitation. In addition to pneumonia, the other primary outcome measure, surgical site infection at 30 days, is assessed in accordance to the central disease control definition. The infection must occur within 30 days of the index operation, and the infection must involve the skin, subcutaneous, muscular, or facial layers of the incision, and the patient must have at least one of the following: purulent drainage from the wound, organisms detected from a wound swab, wound opened spontaneously by a clinician and fever above 38 degrees, or at the surgical wound, the patient has at least one of pain or tenderness, localized swelling, redness, or heat. The diagnosis of surgical site infection by a clinician or radiological imaging. Follow-up at discharge. The follow-up at discharge case report form is completed at the time of discharge from hospital and should be completed by a trained wound assessor. The person who is responsible for the wound assessment should not know which treatment allocation the patient received. This means the assessor will be blinded to the treatment allocation, meaning they will not know the concentration of oxygen received by the patient or whether or not they receive chlorhexidine mouthwash before surgery. Coordinating the 30-day follow-up. Prior to discharge, confirm patient contact details on the contact form are accurate. Arrange and agree a convenient time for the follow-up appointment. Follow-up calls can be performed in person or by telephone. If conducting the follow-ups by telephone, inform the patient who will most likely be contacting them from the research team and the number that they'll be contacted on. This will ensure that the patient picks up the call and responds to the follow-up assessment. To ensure patients are followed up on time, the Penguin patient identification log must be completed for all patients who have entered the trial and received their surgical operation. You should use this log to record the 30-day follow-up date for the patient. 30-day follow-up. All patients should be followed up, including those with wounds less than 5 centimetres during surgery or those who were re-operated on. Follow-up must be performed by a blinded member of the research team. If the primary outcome measure is met before 30 days, the patient should still be followed up at day 30 for secondary outcome measures. If the patient is still in hospital at the 30-day time point, the 30-day assessment should be completed in hospital. Completing the 30-day follow-up case report form. 30-day follow-up form is completed by the outcome assessor. The sections highlighted by the green boxes are questions the outcome assessor will ask the patient to answer during their follow-up assessment. The questions in the red boxes were completed from hospital notes or records with no input from the patient. 30-day follow-up script. The 30-day follow-up assessment is conducted by telephone. The outcome assessor must use a standard telephone script for telephone follow-ups. This guarantees consistency across all sites when performing data collection by telephone. A member of the research team, blinded to the trial treatment allocation, will contact the patient and ask the questions from the follow-up form. This will most likely be a research nurse. In the case of children, a member of the research team will contact the parent guardian who will assist in answering the questions. This slide just recaps on the data collection time points within Penguin. The informed consent, patient contact, randomisation and baseline forms should be completed at baseline and preferably before surgery. On completion of surgery, the intraoperative and intervention adherence forms must be completed. Prior to discharge or at discharge, the follow-up at discharge form must be completed for the patient. And then 30 days post-surgery, the 30-day follow-up form is to be completed. The trial exit form and serious adverse event forms can be completed for a patient from the date of surgery up until 30 days post-surgery. Thank you for listening to the Penguin follow-up training. The next training module will be on safety reporting.